I regret to inform you that we have terminated the employment of Dr. Eva Rostova. Effective immediately. I stood at the back of the packed auditorium, my blood turning to ice. The man on the stage. Martin Cross, the CEO of Sonova Therapeutics, wasn't just my boss. He was my mentor, the man who had personally recruited me, who had shared excited lunches with me, planning how we would change the world. Now, he was pointing a laser, not at me, but at my life's work, projected onto a massive screen behind him. The Phase 2 trial of the compound known as RL7, he continued, his voice dripping with curated, theatrical sorrow, has been halted. Not only did it fail to meet any, and I mean any, primary endpoints, but we have discovered significant irregularities in the baseline data provided by Dr. Rostova. A collective gasp rippled through the room. This wasn't a shareholder meeting. It was an emergency press conference. Martin had called in reporters from the Boston Globe, from Stat News, from every major biotech journal. He was doing this publicly. Irregularities, a reporter shouted. Are you alleging fraud? Mr. Cross. Martin held up a hand. The picture of reluctant duty. I am alleging a severe breach of protocol. A reckless misrepresentation of data that put patient lives at risk. Sonova Therapeutics has a zero-tolerance policy for this kind of behavior. We are a company built on integrity. The lie was so audacious it stole the air from my lungs. I wanted to scream. I wanted to scream that RL7 had performed exactly as I designed it to. But my throat was paralyzed. The flashbulbs from the cameras started to pop. A blinding, disorienting strobe effect. Whispers erupted around me. Rostova. I knew it. Reckless. I had come here thinking this was a standard quarterly update. I was wearing my normal lab attire, a simple blouse and slacks. I felt underdressed for my own execution. Martin's eyes, cold and managerial, scanned the crowd. He hadn't seen me yet. Our internal review is ongoing, he said, and we will be cooperating fully with the FDA. Our priority, as always, is patient safety and rebuilding the trust that was so carelessly broken. That was the signal. As if on cue, 2 broad-shouldered security guards, men I'd nodded to every morning, materialized on either side of me. They didn't touch me. They didn't have to. One of them, Frank, just leaned in and whispered, his voice devoid of all familiarity. Dr. Rostova, we need you to come with us. Please. Quietly. Every head in the auditorium turned. The whispering stopped, replaced by the heavy, wet sound of camera shutters clicking. They saw me. Martin saw me. He didn't flinch. He just held his gaze. A mask of profound disappointment. As if I had betrayed him. That was the worst part. The look. They didn't lead me to an office. They led me straight past my lab, where my team was now staring at me through the glass. Their faces a mixture of confusion and horror, directly to the front lobby. Another guard was already there, holding a small cardboard box, my coffee mug, a framed photo of my parents, my spare notebook, the artifacts of a 20-year career, boxed up like party favors. Your access card has been deactivated. You are not permitted on Sonova property. A formal package will be mailed to your residence. Frank recited. I was pushed out of the revolving glass doors and onto the cold pavement of Cambridge Parkway. The press conference was still happening inside. I stood there, clutching my pathetic little box, as the Boston traffic roared past. It wasn't just a termination. It was a character assassination. A public burning. Martin Cross hadn't just fired me. He had systematically and brilliantly destroyed me, and as I stood there, humiliated and completely broken, I had absolutely no idea why. To understand the betrayal, you have to understand the science. My name is Dr. Eva Rostova. For my entire adult life, I have been obsessed with one single, elegant problem: targeted drug delivery. In oncology, in treating cancer, we have always had the bomb. We have brutal, powerful chemotherapy agents that can kill cancer cells. The problem is, they don't just kill cancer cells. They kill everything. They are imprecise, devastating. They're the biological equivalent of dropping a nuclear weapon on a single neighborhood. My entire career was dedicated to solving this. I wasn't interested in building a bigger bomb. I was interested in building a smart one. A microscopic, biological missile that could travel through the bloodstream, ignore every healthy cell, and deliver its payload only to the unique protein signature of a tumor. I spent 6 years on my postdoctoral work at MIT. Long before Martin Cross ever knew my name, I worked endless nights, funded by tiny grants and fueled by bad coffee. And I did it. I synthesized a compound, a carrier molecule that was inert, harmless, but had an uncanny ability to bind only to glioblastoma cells, a vicious, incurable type of brain cancer. It was my life's work, my baby, and I patented it. I filed U.S. Patent number 84992B1, a composition for targeted molecular delivery. But a guidance system is useless without a warhead. I needed resources. I needed a lab. I needed a pharmaceutical partner who could help me develop the other half the toxin that my Rostova link could carry. That's when Martin Cross found me. He came to my tiny shared lab at MIT. Radiating charisma. He wasn't a scientist. He was a venture capitalist who had become a CEO. He spoke in visions, not data. "Eva," he said, leaning against my cluttered workbench. "I read your paper. It's the future. Sonova Therapeutics isn't like the big guys. We're nimble. We're hungry. We don't want to just make profits. Eva, we want to cure the incurable." He offered me my own lab, a full team, a budget that made my head spin, and he offered me the chance to work on both parts: my delivery system and a new, experimental toxin that Sonova had shelved, a compound called SN Vectra. It was a dream. I signed, and I made one tiny, crucial stipulation in my contract, a stipulation Martin himself had called a brilliant show of academic integrity. My foundational patent for Rostova Link, now renamed RL7 for the project, would remain my personal property. I would license it to Sonova Therapeutics for internal research use only. Martin had smiled and signed. Of course. Eva, we're partners in this. For 3 years. It was a perfect partnership. I worked harder than I ever had in my life. Martin was my biggest cheerleader. We had 2 separate development tracks. Track 1 was my baby RL7. We had to prove it was safe. We had to prove it did what I claimed: travel through the body without causing any effect. Good or bad. It was just the delivery truck. Track 2 was the warhead SN Vectra, a nasty, powerful compound that my team was tweaking, trying to find a way to make it chemically bond to RL7. The plan was to get FDA approval for both components separately, then combine them in a final, revolutionary Phase 3 trial. The press conference, the failure that Martin used to destroy me, was the final report on the Phase 2 trial of RL7. By itself. It failed because it was designed to fail. The report, the one I had submitted to Martin just a week earlier, showed conclusively that RL7, when injected into patients, did nothing. It caused no side effects. It cured no cancer. It circulated, bound to tumors as predicted, and then harmlessly dissolved. It was a staggering 100% success. It was the safe delivery truck I had promised. I had walked into Martin's office, beaming, holding the report. "It's perfect. Martin, it's harmless. It's the perfect vehicle. Now we can start the work. Now we can attach the warhead. He had looked at the report. His face unreadable. He didn't smile. He just said, "Thank you. Eva, this is detailed. Let me review this with the board. You've done great work. Why don't you take the rest of the day off?" I remember walking out of his office, feeling a tiny, cold prickle of confusion, but I dismissed it. He was the CEO. He was probably just processing the numbers. 1 week later, I was standing on the pavement, clutching my coffee mug, publicly branded as a fraud for delivering the exact, perfect result that would one day save millions of lives. The first month was a blur of shame. My life inverted. I went from being a leading mind in oncology to a pariah. The articles were brutal. The Rostova scandal, how Sanova's rising star fell, data falsification rocks, Boston biotech. Martin had played it perfectly. By alleging I'd misrepresented data, he had poisoned the well. No one would believe me. To the world. It looked like I had promised a miracle cure with RL7. And when it predictably did nothing, I had been caught. I tried to fight. I hired a lawyer with what little savings I had. Sanova's legal team, a $100,000 an hour army from a firm in downtown Boston, buried him in motions. They countersued me for reputational damages. Milover, a good man, finally told me, "Eva, I can't beat them. You're facing millions in legal fees. You have to declare bankruptcy." I didn't just lose my job. I lost everything. I sold my condo in Beacon Hill to pay the first round of legal bills. I moved into a tiny, third-floor walk-up apartment in Somerville, the kind with drafty windows and a radiator that banged all night. My colleagues, the team I had built and mentored, stopped returning my calls. I was radioactive. I tried to find other work. I applied to Novartis, to Pfizer, to tiny startups. The response was always the same, a polite, ice-cold rejection. "While your qualifications are impressive, we have decided to move forward with other candidates." I couldn't even get a job as a community college chemistry tutor. I spent my days in the public library, surrounded by the smell of old paper and disinfectant, sending out resumes that I knew would go straight into the trash. I was drowning. And all the while, one question burned in my mind. Why? Why would Martin destroy his own project? Why would he sacrifice the most promising cancer drug of the decade just to ruin me? It made no scientific sense. It made no business sense. The answer came on a rainy Tuesday. About 4 months after my firing, I was at the library, supposedly applying for jobs, but really just scrolling through financial news, torturing myself. I saw a headline, "Sanova Therapeutics, stock soars, on numerical drug announcement." My fingers trembled as I clicked the link. The article was fawning. Martin Cross, it said, had masterfully steered the company away from the disastrous RL7 project and had streamlined the pipeline, fast-tracking a new, revolutionary glioblastoma drug, a drug that was showing unprecedented efficacy in early trials. The drug was called Sinovectra. I froze. SN Vectra. That was my name. The name I had given to the warhead. The cytotoxic payload. But on its own, SN Vectra was just as useless as RL7. It was too unstable. It couldn't target tumors. It was just poison. Unless my heart started to pound against my ribs. Aphantique. Trapped bird. Unless he didn't stop the project. Unless he just removed me from it. I dove into the public-facing FDA trial database and the U.S. Patent Office website. My hands were shaking so hard I could barely type. I searched for Sinovectra. And there it was. A new trial. Filed by Sanova just 3 days after I was fired. I read the molecular breakdown. The compound data. My vision blurred. It wasn't just SN Vectra. The formula, it was a combination. It was SN Vectra bonded to a carrier molecule. A carrier molecule with the exact, precise, unmistakable signature of my RL7. He hadn't just stolen my warhead. He had stolen my guidance system. My failed project. He had taken my two separate, useless components, combined them just as I had planned, and branded the resulting smart bomb as his own invention. He had fired me for the failure of the key, so he could secretly use it to open the lock and claim he'd built the entire treasure chest himself. I felt a sudden, terrifying clarity. The humiliation that had been strangling me for months evaporated, replaced by a cold, sharp, diamond-hard rage. He had built his new miracle on the back of my public execution. I kept digging. I found the announcement for Sinnova's annual shareholder meeting. It was in 2 weeks. At the Weston Copley Place ballroom, Martin Cross was the keynote speaker. The entire event was a victory lap for Sinnovectra. I looked at my bank account. I had almost nothing left, just enough to cover next month's rent. I logged onto my E-Trade account. I sold the last few shares of old tech stock I'd been clinging to, and with the last $700 to my name, I bought one single, solitary share of Sinnova Therapeutics stock. I couldn't afford a lawyer. I couldn't afford a press agent, but I could afford a ticket. And as a shareholder, they would be legally required to let me in the room. The ballroom was electric. You could almost taste the money. The room was a sea of dark, expensive suits, and the scent of optimistic perfume. Banners hung from the ceiling, all proclaiming the same message in sleek, confident blue lettering: Sinnovectra, the future of oncology. I slipped in through the side door, my single shareholder name badge clutched in my hand. I was wearing my best and only suit, a charcoal gray outfit that was 5 years old and felt a size too large. I looked like a ghost haunting a banquet. I found a seat in the farthest back corner, behind a potted plant, and I waited. Martin Cross took the stage to a standing ovation. He was glowing. He was the man of the hour, the visionary who had saved his company and was now, apparently, saving the world. Thank you. Thank you. He beamed, spreading his arms. What a year. What a journey. He launched into his keynote. It was a masterpiece of corporate theater. He spoke of hard decisions and unwavering focus. He showed slides, graphs, all climbing up and to the right, patient prognoses, market projections. Today, we are not just announcing a drug, it declared, his voice booming with messianic fervor. We are announcing a revolution. Sinnovectra is projected to clear Phase 3 by the end of next year. Our partners are projecting revenue of over $3 billion in the first 5 years alone. The applause was deafening. The board members in the front row were beaming. This was it. This was the payday. And now, Martin said, smiling magnanimously, I'd love to open the floor to a few questions. Hands shot up. The first few were softballs from friendly analysts. Mr. Cross. Can you speak to the manufacturing pipeline, Mr. Cross? What about market penetration in Europe? Then, a reporter from a major financial paper stood up. Mr. Cross. A question about the past. Your stock took a significant hit earlier this year with the Rostova incident. How can you assure shareholders that the internal controls that failed then are fixed now? The room cooled slightly. Martin sighed. The practiced, painful sigh of a leader burdened by the failures of others. Affaire question, he said, nodding gravely. Dr. Rostova was, as I have said, a brilliant but troubled scientist. Her RL7 project was a dangerous dead end. A vanity project that consumed resources and produced nothing. We had to make a hard choice. We had to cut that cancerous limb. He paused, letting the metaphor land. To save the body. The success of Sinovectra is the proof that our controls work. We identified the failure. We removed it. And we moved on to victory. Next question. He pointed to someone else. But it was too late. I was already moving. I stepped out from behind the potted plant and walked, my heart hammering a hole in my chest, to the central Q&A microphone. I could feel every eye in the room pivot to me. A voice, clear and cold, cut through the hush. That's a lie. Martin's smile froze. He squinted into the lights. His face went from charismatic to confused to utterly, terrifyingly pale. He knew me. Eva, he whispered, forgetting the microphone. What? What are you doing here, security? I'm a shareholder. Martin, I said. My voice didn't shake. I was amazed it didn't shake. I own 1 share, and I have a question. The security guards were starting to move, but the reporters were already buzzing. This was blood in the water. You're right about one thing, Martin, I said, my voice amplifying through the ballroom. The RL7 project was a dead end, on its own. You described it as a cancerous limb, but a more accurate term would be a key. A key that was designed, from its inception, to fit a very specific lock, the lock you're calling Sinovectra. The room was dead silent. I could see the board members turning to look at each other. This is absurd, Martin sputtered, trying to regain control. Sinovectra is a proprietary compound developed after your termination. It is the sole intellectual property of Sinova Therapeutics. Is it? I interrupted. Is it really? Martin, because Sinovectra, the warhead, is useless. It's unstable. It doesn't work unless it's attached to the key, unless it's attached to RL7. This is conjecture. You have no proof, he yelled. I don't need conjecture, I said calmly. I have this. I'd like to direct the board of directors and the press to the United States Patent and Trademark Office. Specifically, patent number 84992B1, a composition for targeted molecular delivery. I locked eyes with Martin. His face was ashen. It was filed 6 years ago, I said, projecting to the entire room, long before I ever met Martin Cross. It's not a corporate patent. It's a personal patent. And it's in my name. I let that hang in the air for a beat. The legal counsel in the front row was already typing frantically into his phone. When I joined Sinova, I continued. I licensed that patent to the company under one very specific condition, a condition Martin himself signed off on. For internal research use only. That means, gentlemen of the board, the $3 billion revolution you just based your entire future on, its efficacy is 100% dependent on my compound. I took a deep breath. And you do not have a license to sell it. You do not have a license to commercialize it. You built your miracle on stolen land. Which means, Martin, your revolution doesn't belong to Sinova. It belongs to me. Shouts. The word doesn't do it justice. The reporters were shouting. The board members were on their feet, yelling at Martin, the head of council. A man with a face like a collapsed building was staring at his phone, then at me, then at Martin. He knew I was right. Martin just stood there, his mouth opening and closing, a fish drowning on stage. The man who had destroyed my life with 1,000 calculated words didn't have a single one left. I was no longer in the ballroom. I was in the emergency executive boardroom on the 40th floor. A sterile, glass-walled room overlooking the Boston Harbor. The mood wasn't just frantic, it was apocalyptic. The head of council, a man named Harris, had his jacket off and his tie loosened. The chairwoman of the board, a pragmatic and terrifyingly smart woman named Eleanor Hayes, sat at the head of the table. Stiepel. The stock had been halted. The press was being held in the ballroom with no comment. And Martin Cross was not in the room. He had been asked to wait outside. She's right, Harris said, slamming a printed copy of my patent onto the table. The license is research only. The language is ironclad. She filed this at MIT. It's hers. If we move to commercialize Sinovectra as it is currently formulated, she can sue us into oblivion. She'll win. She'll get an injunction. And our $3 billion drug will be dead in the water. Eleanor Hayes finally looked at me. I hadn't said a word since I sat down. I just drank my glass of water. Dr. Rostova, she said. Her voice, a low, controlled hum. It seems we have a problem. And it seems you are the only solution. You have several problems. Eleanor. I corrected her. The patent is just the first one. Your bigger problem is that your CEO just lied to his shareholders on a live feed. That's a massive crime. Harris winced. Let's focus on the immediate issue. Shall we, doctor? What do you want? I set my glass down. The sound was very loud in the silent room. I want several things, and they are not negotiable. I leaned forward. One, Martin Cross is to be terminated. Immediately. For cause. You will issue a public press release stating that he was terminated for misleading the board and for intellectual property theft. And that same press release will contain a full, public retraction of every statement ever made against me. And a formal apology. Eleanor didn't blink. Done. I continued. 2. My name is to be restored to the project. Not just as a contributor, as lead scientist and director of the oncology program. The drug will be renamed the Rostova Vectra Project. That is its name now. Harris started to speak. The board will have to. Done, Eleanor said again, cutting him off. She looked at me. What else? This was the part I had rehearsed in my tiny Somerville apartment. 3. I said, I am not licensing RL7 to Sonova. The color drained from Harris's face. But you said, if we don't have the license. I'm not licensing it. I said, I am selling it. An exclusive. Perpetual. Worldwide license. I am selling you the key. Eleanor relaxed. Just slightly. This was terrain she understood. All right. What is your price? I looked her right in the eye. Martin projected $3 billion in 5 years. The price for my patent is $300 million. Harris exploded. That is outrageous. That's highway robbery. The board will never. And, I said, speaking over him, a 12% royalty on all global net sales of the Rostova Vectra drug, in perpetuity. There was a profound silence. Harris looked like he was going to have a heart attack. Even Eleanor seemed stunned. 300 million, she repeated, tasting the words, and 12%. That's my price. I said. I stood up, smoothing my old suit. You're in a terrible position. Eleanor, your entire company is currently fraudulent. Your CEO is a liability who is, at this very moment, probably shredding documents. Your stock is about to be worthless. I am offering you a way out. I'm offering you the only way out. You get the drug, the cure, and the scientist who actually knows how to make it. In exchange, I get what I'm owed. I walk to the door. You have 10 minutes to discuss it. After that, I walk out that door. I call the Wall Street Journal, and I give them my patent number. Your company will not exist by Monday. I didn't wait for a response. I walked out and stood by the elevator, watching the second hand on my cheap watch. I didn't even make it to 2 minutes. The door opened. Eleanor stood there, We agree to your terms. Dr. Rostova, welcome back to Sonova. It's amazing how fast the world can change. 6 weeks later, I was back in my lab. Except it wasn't my old lab. It was the entire executive floor. The Rostova Vectra oncology program was now the company's flagship top-u dash. And I had a budget that made my old one look like a rounding error. My old team, the ones who had been too scared to return my calls, were all back. They had approached me, one by one, and full of apologies. Eva, we're so sorry. We never believed it. Martin, I held up a hand. It's done. I said, I don't care about what's behind us. I only care about what's in front of us. We have lives to save. Let's get to work. I was in my new office, the one with the floor-to-ceiling view of the Charles River, when my assistant buzzed, Doctor, the afternoon news feed is up. I clicked the link. The top story wasn't about me. It was about him. Former Sonova CEO Martin Cross arrested, faces federal investigation for securities fraud, wire fraud, and intellectual property theft. His picture wasn't the charismatic keynote speaker. It was a haggard, grainy mugshot. It looked small. I closed the window. The money was abstract. Seeing $300 million in a bank account doesn't feel real. It's just a number on a screen. The respect, the apologies, even the vindication, they felt good. But they weren't the victory. The real victory came 3 months later. I was visiting the clinical trial ward at Mass General, the one we had fully funded. I was there to review the new patient data. The results were better than I had even dared to dream. Tumors were shrinking to nothing. A woman, frail but with bright, hopeful eyes, reached out from her bed as I passed. Her chart said, glioblastoma. Stage 4. Her chart also said, remission. Are you Dr. Rostova? She whispered. I stopped and took her hand. I am. She just squeezed my hand, tears welling. Thank you, she said. Thank you for my life. That was the victory. I stood there for a long time. And then I went back to the lab. In science, we are taught that every action has an equal and opposite reaction. It's the fundamental law of the universe. Martin Cross was a man who thought he was bigger than that law. He thought he could create an action theft, betrayal, public humiliation, and suffer no consequence. He forgot about the reaction. He tried to bury me. He tried to frame me for the failure of a key. He was so blinded by greed that he didn't realize that in chemistry, the most volatile elements are often the ones you try to suppress. He didn't just steal my key. He handed me the keys to his entire kingdom. I learned that the most powerful formula isn't one you find in a test tube. It's not a complex chain of molecules. It's the one composed of integrity, patience, and the undeniable, explosive power of the truth.